So good afternoon. I am Jane Kirschling, Dean of the University of Maryland School of Nursing, and on behalf of myself and Dr. Albert Reese, Dean of the School of Medicine, it is my pleasure to welcome you all to the ribbon-cutting ceremony for the new facilities for our Standardized Patient Program. The Standardized Patient Program is a long-standing collaboration between the schools of medicine and nursing. Just a bit of history about that. In the late 1990s, both the schools of medicine and nursing were using standardized patients on a limited basis with our students and utilizing the facilities of another university. A needs assessment conducted by both schools indicated that the education and evaluation of students could be expanded and enhanced if the University of Maryland had its own standardized patient program. In 2000, the Joint Standardized Patient Program was launched as the Clinical Education and Evaluation Laboratory, affectionately known as SEAL, with two forward-thinking and truly visionary educational leaders, Dr. Louise Jenkins of the School of Nursing and Dr. David Malat of the School of Medicine. They served as co-directors of the program for its first 12 years and built a remarkable enterprise that has shaped education, not only for the schools of medicine and nursing, but it has provided important interprofessional teaching and learning opportunities across the professional schools at UMB. I would ask that Dr. Jenkins and Dr. Malat stand so we can recognize them as the parents of the Standardized Patient Program at UMB. And as a side note, a special thank you to Dr. Jenkins for 12 years of work with Dr. Malat. It's a record. Today we are celebrating our new and expanded state-of-the-art facilities for the Standardized Patient Program, which is under the leadership of Nancy Budd Culpepper, the director of the program. Nancy, wave. And Dr. Catherine Montgomery, chair of the Department of Partnerships, Professional Education and Practice at the School of Nursing, and Dr. David Malat, Associate Dean for Medical Education at the School of Medicine and Director of its Office of Medical Education. In large measure, this celebration is due to the exceptional partnership that the schools of medicine and nursing have with the University of Maryland Medical Center. I will say more about that when I introduce Dr. Mohan Santha, the President and Chief Executive Officer of UMMC, later in the program. But suffice it to say that we are celebrating today because of the generosity of the University of Maryland Medical Center and the shared vision that we all have for educating the next generation of health professionals to deliver the highest quality of care to the residents of Maryland and our region. You will hear a great deal this afternoon about the importance and impact of the Standardized Patient Program. But for those of you who may not be familiar with it, this program allows our students to practice clinical and communication skills with a real person, known as the standardized patient, in a safe and controlled environment, with faculty supervision and extensive feedback and mentoring. Often that includes feedback from the standardized patients themselves, who are highly trained to perform their roles as patients and to assess and give their own feedback on students' performance. Although UMB began using standardized patients relatively early on, today standardized patients are an integral part of the curriculum of medical and nursing schools around the country and are also utilized in formal assessment and testing. To illustrate the program, we've developed a short video featuring some of our students, faculty, and standardized patients. The video.
Very rarely is there education on how to talk to somebody, and we've noticed that that's really important.
As a first and second year student, you don't really get a lot of clinical time. It's mostly kind of studying in books. So when we get to come in, practice doing a history, practice parts of the physical exam, it's invaluable to us.
So like an emotionally charged scenario, you don't know how you're going to react. You know, you need to be better prepared when you deal with that in real life. You have to be strong for your patients to better inform them so they could be prepared for what's going on.
It can be somewhat difficult to teach those skills, but having someone who's objective, having someone who can tell them how it felt to hear certain words, has made the entire experience a more positive experience for the trainees.
So based on the ultrasound that we did, we think you have something called placenta previa. All that really means is that the placenta attached lower in the uterus than we would like it to, and it can kind of cause some of this bright red bleeding you were having earlier this morning.
Okay.
So what we're going to do is your baby looks really good, but we'd like to admit you and just go ahead and keep monitoring you.
We've realized that this was a gap in the education of the fellows, critical care fellows, that they didn't get education in how to communicate difficult topics. And so we approached the School of Nursing as well as the School of Medicine and came up with a curriculum that utilized standardized patients to be able to help teach those important skills.
It's some of the best interactions that we get as a first and second year medical student, and then it even evolves as we turn into third years.
As a nurse now in my practice in the ED, I feel like those experiences help me know how to reduce my anxiety and really be present for my patient and communicate to them clearly what's going on.
So our thought process right now is that she could have a few diagnoses, which is why we want to do further testing.
I think it would have been a great idea to give the mother a better understanding of what the hemoglobin was, the platelets, hematocrit, and exactly what they do for your body.
When they've had to have that conversation in real life, it's changed the way they feel about having that conversation.
So I definitely believe this has been beneficial with the 2 C's, your confidence and your competence, to help you be a better provider for the world out there.
It really does simulate something that we're going to be doing on a daily basis, then also for our examinations as well.
So going through these simulations with standardized patients really lets the fellows feel that they can do this. They can do this in real life with a real patient, with a real family sitting in front of them.
So I would ask everyone who was shown in the video to please stand so I can thank you for doing the video for us. Now, as we continue with our program, it is my great pleasure to introduce the president of the University of Maryland, Baltimore, Dr. Jay Perman.
Thank you, Jane. Thank you so much. You know how much events like this make me happy. And I'm grateful to each and every one of you who's played a role in this. I especially thank our deans, Dean Reese, Dean Kirschling, for their leadership, for their collaboration. And I thank you, Dr. Santha, for your incredible support. There's a lot to be proud of here. We all know now with certainty how important standardized patient programs are to high-quality education in the health professions. As one of the oldest people here, I can tell you they didn't have this for me. Dean Reese can speak for himself. Right now, and some of you know this, I'm chairing a system-wide group, University System of Maryland group of university presidents. And we're looking at Maryland's healthcare workforce. We're exploring several things. How do we promote the very best education statewide in the health professions? UMB obviously plays the central role. And how do we make sure that we train enough health professionals to close the gap in Maryland, to close overwhelming needs in Maryland? And this group has come up with a long list of items that we need to address. But I can tell you that among the very first issues that this group chose to tackle was the availability of facilities such as these. Because everyone in that group understands that giving students adequate experiences in simulated environments is critical to preparing a proper workforce. And when I say workforce, by the way, I do mean everyone. So the fact that this facility is going to be used by students of nursing and medicine, yes, but also by students of pharmacy and social work and genetic counseling, by our colleagues at the University of Maryland Medical Center, and frankly also by colleges and universities across the state that train physician assistants and paramedics and others. That tells me that we're doing something really important, really collaborative, and really consistent with our mission. Tells me that we have the interests of the entire region in mind, that we're here to serve far more than our own community. To provide something like this is a gift, and like you, I've seen the power of standardized patients again and again. I see how students respond. I see how students interact with them. I see how these facilities and this kind of teaching makes our students better. Facilities like this are, yes, the way we'll prepare competent, compassionate professionals. This is the whole package, getting them to be compassionate, empathetic, how to adapt, how to adjust, how to address difficult situations, the delivery of bad news, how to work in teams that are effective, know how to collaborate. So I'm thrilled that we're cutting this ribbon today. I'm thrilled that jointly we're actualizing our most fundamental mission, which is to provide our students with the best education and our patients with the best care. I thank everyone for making this possible.
So thank you, President Perman, for your wonderful comments and for reminding us of the important role in representing the interest of our entire state and region. I now would like to introduce my colleague and fellow dean, Dr. Albert Reese. Dr. Reese is the Executive Vice President for Medical Affairs for the University of Maryland and the John Z. and Akiko K. Bowers Distinguished Professor and Dean of the School of Medicine. Dr. Reese has been a steadfast partner as our schools have collaborated to expand and enhance the standardized patient program. Dr. Reese.
Thank you, Dean Kirschling. I, too, am honored to be here this afternoon to celebrate an event that we share, a program that we share and one that we have significant interest in the long term in behalf of our students and our patients. I'm delighted that we have this newly renovated space here in the School of Nursing that will house the combined program. We often talk about collaboration, Dr. Perman, and I think this epitomizes very much what we reflect often, and that is a perfect example of effective teamwork that accrues to the benefit of our patients. And here, the standardized patient program, being led by both nursing and medicine, represents that level of collaboration. I want to comment and compliment, rather, Dean Kirschling for her leadership, for her partnership, and for making this possible. And so she deserves a round of applause for her work. I also want to reemphasize a comment she made earlier, and that is about the earlier leaders, the efforts of Dr. Jenkins and Dr. Malat. I want to thank them, too, for their clairvoyancy and for their efforts in bringing us to this point. Dr. Malat, Dr. Dean Kirschling pointed out that on a second level, she complimented Dr. Jenkins for working so effectively with you over the years, and I think that also deserves reemphasis. Dr. Malat is a good friend. I want to recognize other members of the academic medicine team. I saw Dr. Parker over here. See Dr. Kizeda, members of the Office of Student Affairs, and also in the Academic Affairs Office. I haven't seen, I see Dr. Dr. Caper in the back, who is the Senior Associate Dean for Academic Affairs. And these are folks who work tirelessly together in order to make this event so successful. As was said earlier, the Standardized Patient Program is dedicated to providing both nursing and medical students with the opportunity to become more compassionate communicators and also influential and effective communicators to members of our medical community. The Standardized Patient Program is an integral part of our school's curriculum, ensuring the opportunity for experiential learning, hands-on learning, and also enriches the students' education experience. Dr. Perman mentioned the old days when some of us were in training. Dr. Santa's too young, he doesn't know that time. And so it was a time when we didn't have this type of opportunity, and our education was quite different. So I think it's really important, particularly the learning of skills, whether it be surgical skills or gynecologic skills or just about any form of skill development. This type of setting is extraordinarily important for students and others to get a first-hand exposure to a standardized patient as opposed to so-called practicing or getting their first exposure to patients who themselves may be in some type of distress. So I think it's a wonderful idea. This idea began in 1963. In 1963, Dr. Howard Barrows was a neurologist and a medical educator at the University of Southern California. And he developed, or at least reportedly developed, the idea of what he called then a programmed patient. These simulated patients later became known as standardized patients and were carefully trained, as you can see in the video, to simulate the activities, the complaints, the symptoms of an actual patient. They are able to do so with such expertise and vigor that it may be very difficult for the uninitiated eye to recognize that they're actually standardized patients and not actual patients. The standardized patient was trained to present not just history of an actual patient, but also the body language, the emotions, personality, and physical findings, so that the student who is actually interacting with the standardized patient will get the full picture as if they are in fact in a clinical setting. And that's extraordinarily helpful and extraordinarily important. There really is no better way to train and then evaluate the clinical skills of a medical or nursing student than in a setting like this. So by providing a realistic setting where students now have the opportunity to hone their skills before working in an actual clinical environment, students will receive feedback, as you saw in the video, directly from the standardized patient, as well as a review of their performance with the faculty. The introduction of clinical medicine courses in the School of Medicine spreads across the entire 4 years of medical school and will incorporate standardized patient exercises to prepare our students to work with actual patients in a clinical setting. So while this program is designed to better educate students, the ultimate beneficiary of this program, or a program like this with standardized patients, will be, in fact, you and me, actual patients. So let me conclude once again by first congratulating all those who have worked tirelessly to make this program and make this which we'll see in a moment, so very important to the life and of the education of our students. Again, I want to congratulate Dean Kersling for her partnership and all members who participated in this effort. Thank you very much on behalf of our patients, and congratulations.
Thank you, Dr. Reese, for your comments. We're going on 18 years strong in terms of this work, and it illustrates how collaboration can work to the benefit of our schools, our campus, and our community. It is now my great pleasure to introduce an individual who has played an important role in making it possible for us to be here today, celebrating this new facility. When the School of Nursing was originally approached by our neighbors across the street, the University of Maryland Medical Center, about opening an urgent care facility on the first floor of the building, it was not completely clear that this was going to be feasible. But as all parties persevered, in large measure because we understood that an urgent care center would help to meet patient needs and improve access to our world-class medical care in Baltimore, and that a new urgent care facility would provide care to those not requiring emergency care and therefore helping those who come to the emergency department to get the care they need in a timely way. We said yes, we needed to make it happen. The new urgent care center opened in the fall of 2016, and it has proven to be a very successful model. An additional benefit is that opening the center meant moving our existing standardized patient program out of its space on the first floor, and that in turn created the opportunity to rethink the facilities needed for the program as it continues to grow. Which brings us here today. The generosity of the medical center and their willingness to provide funding for the relocation of the standardized patient program has made these new state-of-the-art facility possible. But trust me, it was more than a real estate deal. The partnership that we enjoy with the medical center and with our colleague, Dr. Lisa Rowan, through our joint nursing program, represents a unified force that is consistently focused on how we can best prepare the next generation of healthcare professionals to deliver the highest quality of care. So it is with great pleasure that I introduce Dr. Mohan Santha, President and Chief Executive Officer of the University of Maryland Medical Center.
Thank you and good afternoon. Okay. I never get to follow the Dean Reese, on the podium, so I'm pretty excited today. But I have to tell you, on behalf of the University of Maryland Medical Center and the leadership team, we are very excited to be here today and to celebrate with you our ability to support this very important initiative. Truth be told, as Dean Kirschling just described, I don't deserve to be standing here because when you talk about the vision and the wisdom of the decisions that were made that allow us to celebrate the opening of this center, there are other individuals who deserve far more credit than I do, and I want to make sure that they are recognized. Keith Persinger, who is our Chief Operating Officer and CFO, or was until he got promoted up into the medical system, was at the forefront of these conversations and these decisions, as was a close friend and mentor and colleague, Mr. John Ashworth. And they definitely deserve the lion's share of credit from the executive standpoint in terms of this decision and this partnership. But I would also have to add that there's probably a single individual within the executive team of the medical center who is, as I like to describe her, the unabashed champion of the power of partnership when it comes to our engagement and partnership with the School of Nursing and the School of Medicine, and that's my friend and colleague, Dr. Lisa Rowan. You know, Lisa and I are in constant conversations about how we can continue to do more to drive the relationships that are foundational to who we are as an academic medical center. When I talk about being an academic medical center, I talk about it with great pride, both as a faculty member of the School of Medicine, a member of the UMB community, and also as the leader of the medical center. I love to quote numbers that say that there are 46 acute care hospitals in the state of Maryland. There are 2 that have the unique mission of being an academic medical center, and institutions that are uniquely focused on delivering the highest quality of care to patients who come to us in great need, but also have the responsibility of educating the future healthcare workforce of our region, our state, our city, and in some circumstances, our nation. And also take very seriously the commitment and responsibilities that we have to innovation. And so while there are indeed 46, there are 2 that are academic medical centers, and I will constantly argue and defend the position that I have that says there is one that has this focus with a unique focus on the state of Maryland. And so we are incredibly proud to be that institution. And so these partnerships, I think, are foundational to how we accomplish our mission. I think back to my own medical education, and in fact, Dean Reese, it was long enough ago that mine probably looked a lot more like yours than you might recognize. But in fact, in the audience today, one of my education mentors, Dr. Bruce Jarrell, who was my professor of surgery back in Philadelphia when I was a medical student, if he and I were to sit and talk and remember those days back in Philadelphia, the truth is, centers like this did not exist. And so ultimately, that meant our education as students took place in the clinical environment. And there are many advantages to that. But there are also some realities to that. And so when you think about what you saw in that video, I could not help but think of my role as a radiation oncologist, a practicing cancer physician, and thinking about the way we have conversations with our patients. And I think of a statement that I often make to students or residents who are with me, or in my role as a CEO, as I talk to our community, I am constantly saying that I believe that there is a nobility to our chosen professions in the delivery of healthcare. And when you think about nobility and you think about what defines nobility, I will argue again that when you strip away the science and you strip away the technology that we use, and when you strip away everything else, at the end it is the essence of how we engage with our fellow citizens, our fellow human beings, and it is ultimately the very work that will go on in a center like this. And so I will say that on behalf of our organization, we are ecstatic to be able to support such a very important initiative. I love the fact that the University of Maryland, collectively defined as both UMB and the medical center on behalf of the system, is leading what should be the national approaches to how we think about innovation in education. So thank you very much.
So thank you, Dr. Santha, for your comments and for your role in fostering the collegial and productive partnership between the University of Maryland Medical Center and the University of Maryland, Baltimore. We are grateful for your commitment, for your leadership, and for your support. We are now at the point in the program where we'll actually cut the ribbon, but before we do so, I want to thank all of you for being a part of our celebration. And I want to let you know that we'll be giving guided tours of the facility. In light of the number of people here today, we'll have groups of 10 to 12 individuals starting every 5 to 10 minutes. So you can begin with a tour, or you can go downstairs and enjoy some refreshments, and then you can come back up in terms of doing a tour. In addition, the School of Nursing's Living History Museum for Nursing is open directly across the foyer. It's the only museum in Maryland dedicated to nursing, and you'll find fascinating displays, artifacts, and materials that chronicle the history of nursing, and for at least a couple of gentlemen in the audience might bring back memories of what it was like when they were in med school. So I would ask that Presidents Perman, Dean Reese, Dr. Santha, Dr. Rowan, and Dr. Jarrell to please come forward and join me in the official cutting of the ribbon.
First group, please follow me.
Faculty can watch the encounters either in these rooms or remotely, and students can also self-assess at their leisure. But we have the screen set up, so for example, on this screen, one of the rooms is set up. There's an activity going on. You can set it to 2 screens. On this screen over here, there's 12 rooms set up. If there were an activity in each room, you could decide which one you wanted to watch. Behind you, there's a screen set up behind the photographer that has one large screen that has just one of the views for that room.
This is the SP training room. We actually have all kinds of SPs. We recruit all ages, sizes, retirees, actors, those folks who are looking for part-time work. We also work with them to assess their flexibility, their ability to remember and evaluate, because their main role is to produce feedback that can be constructive. And that's our primary role as SPs here. SPs are considered educators and not actors. They take their roles very seriously, and we're trained to present a situation as this in a standardized way. The only variable that the student should encounter is the student. So the student should be able to go into any room and have this case presented without any changes, anything different. That's part of the reason it's called a standardized patient.
They receive pre-encounter instructions at this point. Once they've read their pre-encounter instructions and they're logged in, they'll enter a room for a prescribed amount of time with an SP, during which they'll, conduct whatever the particular scenario is. The computer automatically gives them a 5-minute warning and gives them an end of session notification. The students then come out, and then they would relog back into the computer, where they would conduct a self-assessment and quite possibly a patient note. So the patient notes are typical on this side of the room. After they complete their patient note, they'd be invited back into the room for verbal feedback with the SP. This we consider one of the most important things they do, because they get personal interaction coaching on basically how they do that. At the end of the room here, I have a computer model set up where I can basically see what's happening in all the rooms, make sure there's no issues there. I can also adjust the times. If we're running late, I can adjust them up and down, depending, so we can keep the automated timing notifications on cue.
My name is student Dr. Bethany Hoffman. It's nice to meet you. I'm a first-year medical student, and I'm working with your team. Would it be okay if I talked with you for a little bit?
Sure, that'd be great.
Okay, I just want to start off with asking you how you're feeling.
Well, I'm very weak, and I'm tired, and I'm having a hard time breathing.
I'm sure, that's understandable. We have the results of your tests, and I'm sorry if this is difficult news that I have to give you, but we've discovered that you have pneumonia, and we're going to have to admit you for a few days.
Oh, no, what? Pneumonia? I can't stay in the hospital. I can't be here. I got to get to work. I got to feed my cat. I've never been in the hospital before.
I understand. I'm sorry if this is difficult for you. Because we want to treat you with IV antibiotics and give you fluids, it's important that we do keep you here for 2 or 3 days. I'm sorry to have to be the one to tell you.
What am I going to do? I can't do this.
We have some resources here at the hospital that I can look into. Perhaps do you have a relative or a friend that perhaps I could call for some support for you?
My sister's in Oregon. Yeah, I have a friend at work that you could probably call.
Okay, I'd be happy to make that phone call for you, and we can definitely sort out making sure that your cat gets taken care of and all
Thank
that.
you. I know it's
I'm
not
so
so.
sorry to be the one to have to tell you this. I know you didn't plan to have to be in the hospital this
I
week.
didn't think that would bring me here, but thank you so much.
But it is the best way that we can make sure that you get better.
All right, I get it. I don't like it. I just don't want to be here.
I completely understand that. So I'm going to check into those resources for you, and I'll send someone in to help you make phone calls. Does that sound okay?
Yeah, that's good.
Okay, great. Thanks.
Thank you.
Thank you both.
Thank you.
That's good.